Section 2. This section is just very important. We're going to talk about pain perception. We're going to talk about different types of pain, and we're going to talk about like different processes that can help us to perceive pain. Pay close attention to me because like I would say this is like the core idea of chapter 10, and there are going to be a lot of questions in your quiz, as well as, it's just very important. It's just help you a lot with your life. Don't actually think about your quiz. Just try to understand the material. So let's begin. Here we're going to talk about different kinds of pain perception. Mechanical nociception, it's going to be whenever you are doing like you're just reading a book and you are having paper cut, like you are experiencing paper cut. It's going to be some sort of mechanical damage to your tissues in your finger, which actually gonna bring you pain. So it's going to be mechanical nociception. Another way of pain perception is going to be thermal damage. Whenever you are touching a hot surface, it is bad, right? We don't like that. But again, you're going to actually cause pain by temperature, like due to temperature experience, because like the temperature, it was just very hot. So this happened to you. The last one going to be polymodal nociception, which going to be based on chemical reaction. I'm going to give you an example. Whenever you are dyeing your hair, the hair color for some people, it's going to actually burn their skin. So this is going to be polymodal nociception. You have to use some sort of, I don't know, cream or something to just protect your skin, especially here, because like it's just happening to me all the time. And so far I didn't know that, why I'm experiencing that on and on, but now I can understand that because the sake of health psychology. So now I do have a good example for talking about polymodal nociception, burning your skin. There is a theory out there for pain perception. Its name is gate control theory of pain. It's a very simple theory, but over time it developed better and better, which I'm going to talk about this soon. But before that, we should just know about there are going to be two major types of pain fibers. Number one going to be A delta fibers, number two going to be C fibers. A delta, they're going to be a small one, but they are just myelinated. So basically, they're going to go very fast, like all the signals, they're going to go very fast. They're going to jump and jump. So it is necessary for responding to mechanical or thermal pain because like they're going to transmit very fast and they're going to actually give our brain the signal for very fast pains. Which can be again mechanical, paper cuts, and thermal one. Whenever you're touching a hot surface, you're not doing a hot surface. So, C fibers, they are just very slow because they are not myelinated, right? And they are actually involved in polymodal pain. Like the transmission gonna be dull, but you're gonna have like some sort of aching pain because like it's just very slow. Like it's not happening right at the moment. It's gonna take some time to just experience that kind of pain. There are gonna be some specific regions in your brain that perceiving pain and help you a lot to just modulate that pain. So some of them they're gonna be in your midbrain, which gonna result in pain relief. But the main part is in your cerebral cortex, which is going to help you a lot about cognitive judgment of pain. I'm going to give you another example. Previously, I talked about moms. Whenever they have a lot going on, they do have children, they are working outside, they have to cook, they have to clean and all that. Hopefully, daddy is helping, but if not, they have a lot going on. So sometimes they are experiencing back pain. But due to their responsibilities, they don't care and they wouldn't address that back pain, which gonna bring them problems in 10 years or maybe even sooner. But the point here is it's all about mom's cerebral cortex, which gonna do the cognitive judgment to just address the pain or not. However, when it happens to us, we're gonna just address that very quick, very fast because we don't have a lot going on, right? So that part, like that difference between mom's brain versus us, it's going to be cognitive judgment. And it's going to be cerebral cortex that's going to be responsible for that. Another example of that is whenever you are going to a doctor, you're going to try to just interpret or you're gonna you're gonna try to talk about your pain. It's gonna be again cerebral cortex. So cerebral cortex is just very important in higher order reasoning and also helping you to just have some sort of specific cognitive judgment about your pain. This is important. I mean, cognitive judgment is important. Also, this figure is important too. Here, just basically what I was trying to talk about. It just whenever you are just having pain, there's gonna be some sort of reflex action. Your pain gonna go to your spinal cord, and after that, your brain, they're gonna do cognitive judgment, which gonna be again your let's say cerebral cortex, which gonna judge the processes. Another point is here you can just see heat or chemical release of like some sort of substances that's gonna bring you damages. If, for example, it would be heat or if it would be paper cut, definitely it's gonna be A delta fibers. However, for polymodal, which we already talked about that, for example, chemical damage, it's gonna be C fibers. Keep that in your mind. So here we're going to talk about neurochemical basis of pain and its inhibition. So we already know that there are going to be some sort of processes in our brain. So this way our brain going to help us to not having like some sort of excessive response to some minor pain. For example, if you are experiencing paper cut, you shouldn't be dramatic, right? You shouldn't just scream, like cry and all that. I know some people, they do that. But in general, over time, you're gonna learn that it's not that much dramatic. And this is like your brain who gonna block some sort of pain signals. So this way, you're gonna have some sort of minor responses to minor pains, if that makes sense. So for example, if you would have, God forbid, car accident, you can be dramatic and your brain, it wouldn't block any sort of signals, pain signals. But for paper cut, your brain should be mindful and do cognitive judgment in a good way. So this way, it's gonna block some sort of messages. This way, you wouldn't just answer dramatically to a paper cut or a minor pain. This actually leads to the idea of endogenous opiate peptides, which gonna be a natural pain suppression of your body. It's very good. I never experienced that, but I can see a lot in addicted people. They're gonna enjoy a lot of opiate. So it's gonna help a lot with just reducing sensitivity to pain. And it feels good. Whenever you are not having pain after experiencing a lot of pain, you feel like relaxed and you just chill and enjoy. But don't do opioids because like they are not good. So another example, another idea here is a stress-induced behavior, which gonna be a phenomenon. Whenever you are having a lot of stress in your life, stress gonna reduce your sensitivity to pain. I know it is kind of crazy because so far I was just telling that, oh, people who are anxious, they're gonna actually they're gonna actually report more symptoms to their doctor. They're gonna be very negative. However, if you're experiencing a stress for a long time, I would say there is no energy to report your symptoms to anyone because you do have chronic stress and it's been a long time you are just doing that. You are very negative to just go and address your problem. So that's why you're going to reduce your sensitivity to pain. However, again, it is like a general idea and it's definitely different from one person to another. But for majority of people, it should be the same. But since I'm just very skeptical, even majority of people, most of the time, it's going to be Caucasian people or some specific races. So definitely it's going to be different from one culture to another one or from one race to another one. So it's just a general idea here. Yeah, I just wanted to clarify. So that's the good part. Here we're going to talk about acute pain versus chronic pain and other pains. So acute pain, we already know that it's gonna be very fast, it's gonna be very specific injury. It might bring us a lot of pain, but the duration of that gonna be short. Most of the time, it's gonna be less than 6 months. I talked about acute pain before, I guess it was in section 1. I don't remember if I said if it is lasting more than 6 months, but if I said that, it is wrong. It is definitely lasting less than 6 months or 6 months. So it's gonna be acute pain. If your pain is just lasting more than 6 months, it's gonna be definitely chronic pain. Um, and you have to address that because it's just lasting more than 6 months. My goodness. There are going to be different kinds for chronic pain. It's going to be benign pain, like chronic benign pain, which going to be more than 6 months or even longer. Whenever you are not responding to your pain, it's going to be benign pain. So again, you have to just address that. Severity of that going to vary because like it's just it might be increasing or it might be decreasing. We don't know. But if a pain is just lasting more than 6 months or 6 months and you wouldn't address that, it's going to be definitely chronic benign pain. Recurrent acute pain is just also important. It is like whenever you do have a pain that's going to come and go, and it's going to bother you a lot because it is pain. It's gonna actually happen more than 6 months, but it's not consistent. It's gonna come and go. For example, whenever you're experiencing migraines, most of people who are having like migraines, they're gonna have it for like years, but it's not like every day. It's gonna be, for example, 2 days, then it goes, then it's gonna be another week. You see what I'm saying? It is not constant. It's not consistent. So it's going to be the idea of recurrent acute pain. It is very painful. It is very annoying, but it's not consistent. It's not 24/7. Chronic progressive pain is like that kind of pain that's gonna last longer than 6 months, and it's gonna increase in severity over time. I don't know why I'm just smiling, but yeah, it's very painful. It's not good. It's gonna actually associated with degenerative disorders. For example, there is like a specific kind of diabetes. I guess it is like neuropathy diabetes. But the story is when over time you do have that kind of diabetes, the level of sugar, it's gonna damage your nerves. So over time, you're gonna experience numbness, like your fingers, they cannot actually feel anything, or you're gonna actually experience some sort of headaches over time. So it's gonna be chronic progressive pain. It is lasting for a long time, more than 6 months. And over time, you're gonna actually lose some control and you're gonna have like damages all over your body. There are gonna be like different sources for chronic pain, but the common ones, it's gonna be like back pain, which is just very common for Americans, and I would say for my culture as well. Iranians, they also suffer from back pain a lot. I guess it's just very common in every culture because we don't know how to sit correctly, and our body posture most of the time is not the best. Part of it is just based on our nutritions, like we don't have enough, I mean, our like our bones, they are not very strong because of our nutritions. We have to be more careful for ourselves and our children as well. But yeah, back pain is just very common. Like you can see, 70 to 85% of Americans, they are just suffering from that. Headaches, they are very common. We all experiencing that a lot, which is not good. Cancer pain is just getting more and more, especially people who are in their last stages. For example, advanced cancers, they are actually suffering from moderate to severe pain. And there's going to be some sort of arthritis of pain as well, which going to be 40 million Americans that going to suffer from that. And okay, it doesn't go to the next slide. Yes, it's here. So they're going to be like, again, different sources for chronic pain, neurogenic pain, which going to be pain that's going to actually damage your PNS and CNS. PNS, again, going to be peripheral nerves, which we talked about that in chapter 1, chapter 2. and central nervous system, which is going to be your central spinal cord and brain. There are going to be some psychological consequences of pain as well. For example, we're going to have some pains that's not actually based on your physical condition. It is like based on your mental condition. We talked about this as well, but yeah, it's going to be psychogenic pain. Here we're going to talk about acute versus chronic pain. They might, I mean, most of them, they can have psychological basis as well. But like chronic pain, they're gonna actually bring us a lot of negative energy over time. So that's why when you are having chronic pain, after some point, you're gonna have a lot of negative feeling as well. So you have to address your mental health periodically when it comes to chronic disease. If you do have diabetes, if you are suffering from cancer, you have to just go to, I mean, not have, but it's just better. It's actually good idea to just go to a therapist and just address your mental health as well in the beginning stages of that problem.